So Dr. Shoyinka is here with me today. I'm actually coming to you live from a testing event that we have going on. And she's going to walk around a little bit outside and show you what we have going on here in partnership with MSU Health Team. So this testing event is going on right now at right in front of the Kroger, in a little mini strip mall right in front of Kroger on MLK. So these are some of our partners from MSU Health Team that are doing testing. And I think she's going to walk you over to, I don't think she can hear right now, so we'll have to grab the screen away from her eventually. So what she was just showing you right now was our actual testing tent. And then we've got some additional tents where people come up, fill in their paperwork, get their registration and all set up. She turned us sideways. So, and she can't hear us, so she doesn't know, but turn your head. And so this is what we've got going on outside here. And a fairly broadly announced testing event, especially to help us. We are in the 48911 zip code here, and to help us with basically making sure that we get lots of testing done in this area. And as I said, the partnership with MSU Health Team has been huge for us. And so we just wanted to show you some of what we were doing out here. I think she's showing you now a care package that we also give people when they come through, which includes a mask and some flyers about hand hygiene and social distancing and how to properly wear a mask and those sorts of things. So as we do this testing, all of this is part of what we hand out to our folks that are here. And I'm going to wait for another minute here. Oh, good, she's got us back up right. And I think that is about it. So I think I'm going to steal, if I can, screen share away from her. And I can't because she is. I think maybe you can take it away from her, or I'll just go out there and tell her. Huh?
I can stop her.
Oh, there you go. Okay. So there you go. That's where we are. I'm actually going to turn to the other side of the table because the light behind me is causing a challenge. But anyway, so thank you all for enduring that. I thought you might want to see that, given that I'm out here today with them. I'm going to move on now to sharing our data with you as of today. So here we go. Hold on just a minute. There, wait. I got to find there it is. Sorry about that. So basically this is our data effective June 2, 2020. We have 742 cases, 27 reported deaths, 3 in the hospital, 1 ICU. 289 of our patients are out there recovering at home. And then we have recovered 426. So we have a current case fatality rate, and now her audio is on, a current case fatality rate of 3.6%. And we have completed monitoring 883 individuals, and 44 are still active. So in terms of hospitalization, it's basically less than 1% in the hospital. And this is what our hospitalization numbers look like. And so this is our trend in hospitalization. Again, you can see that we have continued to have a few people, Ingham County residents, in the hospital over the last few weeks, but that has dropped down from here and is staying fairly steady right in here and has for a number of days now. So currently we have 57% recovered, 3.6% deceased, 38.9% at home, and less than 3% hospitalized and less than 0.3% hospitalized, or actually 0.3% and 0.1% ICU. So our cumulative case data looks like this, and I think by now you can certainly see this flattening that is going on here. So as we add less cases per day, we expect this curve to flatten. If we look at our incidence curve, this is where we are right now with, as you can see, the number of cases dropping down. Again, that 7-day rolling average does help a little bit to interpret that graph. Positive tests per day are also trending downwards, which is one of the things we were looking for. And then this is what that looks like in a 7-day rolling average. So I would say that since about the 28th or 29th of April, we've been on a steady downward trend in new cases per day. And likewise, since about the 22nd of April, we've been on a steady downward, with the exception of this blip, downward trend of percent positives per day. We still see a number of cases, disproportionate number of cases in 48911, growing a little bit in 48910, below that 48823, which is East Lansing, 48854, which is Holt, the 48906 zip code in Lansing, 48864, which is Mason. So this is our total cases by zip code mapped out with the darkest shading, our highest number of cases. So you see that with 48911, followed by the, there's my mouse, followed by this 48910, as well as this zip code up in here. If we look at that by prevalence rate, again, we see 48911 in terms of rate. So that accounts for the population there is, different from populations in other zip codes and allows you to directly compare them. We did drop off all of the zip codes that have less than 20 cases. So this is only showing shading and relative prevalence in the zip codes where we have 20 cases or more. This is a heat map of the county that shows you basically where we're seeing these cases. All of this shading out here, that if you were looking at a satellite map, you'd say, oh, look at the clouds there. Those are cases, but certainly less in terms of, we're not getting that dark red or really bright yellow as we increase the density of cases throughout the county. A little bit zoomed in so that we see well our 48910, 48911, and other zip codes, which we know we're dealing with higher prevalence in those. So we do see this continued 48911 prevalence with some other, kind of hot spots popping up there. We are currently at 51% of our cases are female, 49% are male. If we look at the cases by age group, again, now that we're adding very few cases per day, it does not change, the relative percents a lot. So this trend in percent has been fairly persistent for quite a while now. And then if we look at our cases by race, we know that we are 48% Caucasian, 28% Black or African American, 16% Asian, 5% other, and then 4% unknown. Again, if we look at that by prevalence rate, adjusting all populations to 100,000 and then calculating the number of cases there would be if that population was only 100,000 in the case of Caucasians, or was as much as 100,000 in the case of African Americans and others. These are what our prevalence rates look like. Again, we still see that significant difference in prevalence rate between Caucasians and really all of our other groups, our African Americans, our Asians, as well as others. Other could include Native American, Eskimo, and some other populations like that. I think the Hawaiian population falls into there as well. So we are, by ethnicity, 84.6% not Hispanic or Latino, 11.1% Hispanic or Latino, and down to 4.3% unknown, which allows us to calculate a fairly good prevalence rate now that we've got that unknown number down, where we see our Hispanic and Latino population at 355 compared to our non-Hispanic, non-Latino population at 232. So now if we look at our deaths by age, we are at 14.8%, 50 to 59 years old, 18.5% at 60 to 69, 25.9% at 70 to 79, and 40.7% over the age of 80. Deaths by sex is basically 48.1% female, 51.9% male. Prevalence by race percent basically is 29.6% African American, 63, excuse me, my dyslexia for a moment, 63% Caucasian, and 7.4% other. If we look at the ethnicity, we see 85.2% not Hispanic or Latino, and 7.4% Hispanic or Latino, and 7.4% unknown. So that is the end of the data. One of the other things that I said that I would show you today, so I'm going to share another screen with you, is the information that we are now able to see on the Michigan dashboard. So if you all go to the Michigan, can you all see this now? Yes, Amanda? Anyone?
I can't see it.
No, we can't see it.
No.
Okay, maybe I didn't share yet. Hold on. Oh, you know what? I didn't pick the right screen yet. Hold on, give me a minute. There we go. There we go. Okay. I should have known because you all pick up on these little thumbnails on the side when I do this. So if you go to the Michigan coronavirus website right now, you will see a MyStart map. Within that MyStart map, there's certain information that is available to you. But this is the map that they make available to us as basically internally public health. So what I have to do is go down here and select a region. So I select my region, which is this one. And then I can look at basically a number of things, test results, and I can see graphs of those test results and thresholds and other sorts of things. I think we have some, so this is what's going on with test results, both in positive test rate as well as daily number of tests. So you see the increasing number of testing that we've been doing in the county here. You can also drop down on a tab that tells you about new cases. So now you can see where the state has us with new cases per day, aligning well with our own data that shows this trend since back in about April 27th or so. You can look at our deaths, which have trended this way. We haven't really kept a track of daily incidents of deaths because those numbers are low. It's hard to graph those very well. And then the other thing we have here is what they refer to as public health capacity. And so again, we're showing the daily tests per million now in our county. And so you see this steady increase basically in testing that's been going on. A little bit of a drop over the last few days. Can't really explain to you why that might be. But in general, a significant upward trend in the daily tests per million that have been conducted here in Ingham County. So that's what I wanted to show you. In addition to being out here at this testing site today. So we're ready for questions, Amanda.
Right, I don't have anyone in the queue right now, so if you have a question for Linda, please go ahead.
Hi, Linda. It's Dave Ackerley.
Hi, Dave.
Hi. Couple of things on today's case number. You listed 742. The state number that came out at 3 o'clock just before said 745 in Ingham County. Yeah.
So on media briefing days, we pulled data fairly early, although they pulled data at
10 a.m.
At 10 a.m. So sometimes
that's why I was asking.
Yep, I hear you. There have been times, I know, and I don't know exactly the reason for this one, there have been times I know that a case will land in MDSS assigned to Ingham County, and then we know that it's not an Ingham County resident. It may have been somebody who died here, and then we've got to work with the state to get that case placed into the appropriate county.
Okay.
So,
all right. Second question, non-related to that.
And I think
The-
I mentioned died. That also is the case with cases. Every now and then,
Okay,
for instance, we're doing testing. Basically, we just have cases that occasionally land in the wrong county. We may have tested them here, but they may actually reside in a different county. And so sometimes those numbers get a little off and we have to correct them.
all right, very good. Second question has to do with today. There were people representing salons, stylists, barbers testifying. They're not happy. And they put out a press release in the last half hour indicating to the effect with a map that Michigan is now the only state in the country that is not allowing them back in some capacity. We are it. Thoughts on that overall risk factor there and how the state is handling that versus, again, the other 49 states?
Well, there is a strategy, and there are risks, and there's, I think in different states and in different places, the assignment of relative risk is the judgment of the medical professionals and the other professionals in that state. And so at the level of the governor and Dr. Caldoun, I believe the assessment is that is still in a higher risk category compared to some of the other things that they have opened. I will say, I personally, and there's such an amount of variability in salons too. So, there are some that the chairs are, just side by side by side by side by side. Now, of course, they can use every other chair, things like that. I go to a salon where everything is very spaced apart. I do think that there are ways to safely re-engage that, but I believe the governor is probably waiting another week or two. I think I heard her yesterday say probably another couple of weeks to do that. Not my call, and I really don't have a way to judge how proper or appropriate that decision was, because I don't have the metrics that they're using or the risk level kind of assessment that they're using to make that determination.
Okay, thanks.
Mm-hmm.
Megan Banta?
So at the event today, those little grab bags, the pamphlets and everything, are those just in English or are they in other languages as well?
They are in other languages as well.
Okay. Do you know which ones?
Oh my gosh, there's a whole list of them.
Okay.
I can't, I'd have to look. I mean, it's quite a list of different languages. Everything from Arabic, Spanish. We have a number of Asian populations here that speak a number of different languages. And we also know that we have impact in our Asian population. So they've all been translated into multiple languages. I think if you go on our website, some of the things that are being handed out to here today are on our website, and you'll see the number of different languages that they're in. Unfortunately, I can't, unless I had one in my hand right now, and I don't, I can't answer that question very well.
I can tell you that it includes Nepali and Swahili, Arabic and English, and there are a few other materials in other languages as well.
Oh yeah, Amanda made them. I should have just asked her.
Yes, some of the graphics were made by a volunteer designer, and other ones I worked on. So if you have any questions about that, I'd be happy to speak with you. All right. Rachel Sweet.
Hello.
Hi.
How are you?
Good. Jason Stevens just walked in. Say hello to the people, Jason. Jason is emergency manager from Lansing, EOC. Duck down a little bit, see, right there.
Hello, everyone.
And is out here today along with MSU Health Team and all these other people helping us today. So again, I think I've spoken to you numerous times about the incredible partnerships that we have here in the area, and that incredible partnership being part of the success that we feel like we've been having, despite the fact that we do have a number of cases and a number of deaths, but I think we've done well. So go ahead, Rachel.
All right. So yesterday, Whitmer's office said that day camps can start June 8th, and that's probably going to make parents nervous. So what would you say to parents who are concerned or have any thoughts preparing their kids to go off to day camps or camps?
Well, I think that they will want to check with the camp to find out what are the precautions, what are the physical, environmental, what are the things that they have prepared in order to keep their environment and their people, not just their employees, but of course the children safe. So that's what I would want to know is, tell me what you've done. Tell me what you're doing to make sure that this is safe. Tell me how you're going to keep my children 6 feet apart, or help them continuing wearing masks if that's what they're going to do. All of those things that we think are very important right now. So as a parent, that's what I would do if I had concerns. I think there is a double-edged sword on the day camps. One thing, we're heading into summer, and a lot of working parents really rely on some of these day camps in order to to have their children somewhere while they go to work. And so I think one of the reasons to open day camps and daycares is really to allow people to be able to go back to work, but only if we can do it safely. So, we've seen daycares open throughout this. So I think day camps probably following the lead of daycares in terms of what are the precautions they've been taking and how they've been doing this safely is probably what I would like to see and what I would be asking as a parent.
Okay. Do you know if kids would have to wear masks all the time, or that's per camp?
That they should be wearing masks all the time inside in closer spaces. If they are outside and stay 6 feet apart, then they don't have to wear masks. I have a 5-year-old granddaughter and a 2-year-old granddaughter. And I can tell you that I do not envy the day camp director, nor the daycare director, nor the school teachers as we start back into school in the fall. My daughter said to me, my daughter's going to kindergarten in the fall with a mask, And for my daughter, that's kind of a little bit, oh my gosh, what is this world? But then, I immediately thought as the public health official, it's like, wow, how are these teachers going to keep masks on kids all day? So, those are some of the things. But yeah, inside, if they have to come inside, masks are going to be important.
Thank you. I have a follow-up question, but I don't want to take over if somebody has another one.
There's no one else in the queue, so go ahead.
Okay. I don't know if this is a dumb question, but are you concerned about bottle returns starting back up at all?
I am, just push hard, Jason. Just trying to get the door open and it sticks. Here would be my advice about bottle return. Bottle return is about touching surfaces again. So I would want bottle return again to be spaced out. I wouldn't want to be crammed next to somebody doing bottle return. If I was close enough to somebody doing bottle return, I would want all of us to be wearing masks. And then the other thing is, we're touching, again, this is just common surfaces, right? We've been learning for a long time about common surfaces. So this is yet another common surface. Bottles and things like that, they're your own, so you have a relative knowledge of, how safe they are, but it, clearly is an environment where you're touching a lot of different things. I presume people have been using ATMs over, this past several months. So my suggestion would be that, the bottle return is, again, re-engaging in activity that is safe, all of which has some risk, but we're talking about lower risk now. And just making sure that, after you do that whole bottle return thing, that you wash your hands. My experience, most bottle returns have that hand sanitizer and stuff to wash your hands anyway, because usually you come away with, a bunch of stickiness from spilled whatever from the bottle return. So I would just say that people just need to be really, really careful, again, about washing their hands.
Okay. And this one might go along with it, with gyms to go back to working out. What will it take to be safe? And do you ever see them going back to normal without a vaccine?
I think to some extent it's going to depend on the gym. So what I would say is like a big aerobic, some of those bigger classes, where you're taking people and you're putting them in a room, a lot of times a room that's not very well ventilated, that you will probably see those classes perhaps not get restarted very fast. When it comes to the gym itself, they can do the capacity limits The gym that I happen to go to, you know, the machines are very far apart as it is, so that allows people to be far apart. A lot of people like to work out with a, you know, like a workout buddy who might not be a household member. And so that's probably going to be something that we're going to want to discontinue as we go back into gyms and facilities like that. The governor did allude to the fact that within the next couple of weeks, some of the things that are still closed probably will also start to reopen. I don't know if she was speaking more specifically to hair salons and things like that, and whether gyms are going to be considered in that same, maybe in another 2 weeks, or whether they're going to get delayed even further. Again, it's a lot of common surface touching, which is what we're re-engaging in anyway. So I think depending on how a particular gym handles it, how their equipment is spaced out, how diligent people are about hand washing and things like that, that it can be safe. Again, mask wearing inside, that's going to be very difficult if you're doing the aerobic part of your exercise. So you might want to figure out how to do that where you're not facing other people. But, you know, when it comes time to, you know, using weight machines and things like that, you know, put that mask back on and be very, very diligent about washing hands. So I don't know when they're going to come back on. I do think that gradually we can re-engage into all parts of our economy as safe as possible, acknowledging that this virus is still here and that there is some risk to all of it. And that, as the governor said yesterday, if we re-engage and we start to see things heading the wrong direction, we might have to close things back down.